Member for Bennelong.
Deputy Speaker, I won't beat around the bush here. Women have been let down on gaps in medical research, diagnosis, funding and health services associated with their health. Women have been dismissed, overlooked and underserved by a system that was never designed with their needs in mind. For decades, women's pain has been dismissed, their diagnoses delayed and their health deprioritised. I thank the member for Mayo for bringing this matter of importance to this place, because it's something that we all need to hear and talk about. And I say to the member for Mayo and all those listening to this debate that as a government, under the leadership of the Assistant Minister for Health, we are doing a lot to address inequality in women's health, and rightly so. We're addressing the painful delays, the funding gaps and the discrimination embedded in healthcare with urgency and purpose. From investments to targeted reforms, we're making it clear women's health can no longer be sidelined. We are committed to listening to women, to understanding their unique health challenges and dismantling the structural inequalities that have persisted in the medical system for far too long. And I'm very fortunate to be able to share one example of this action delivered in my region, Deputy Speaker. During Women's Health Week, I had the privilege of visiting the Hunters Hill Endometriosis and Pelvic Pain Clinic with Assistant Minister for Health and Aged Care. And it was really inspiring to see the dedicated work happening there. This clinic is one of 22 established across the country as part of a $58 million initiative. It's a place where women can receive the multidisciplinary care they need, from pain management to specialist consultations, all in one location. This model should be the standard and not exceptional. The opening of this clinic is a step towards ensuring women are seen, heard and treated with the care that they deserve. Because to me, it's outstanding that, on average, it takes 7 to 9 years for a woman to receive an endometriosis diagnosis. Imagine enduring 7 to 9 years of pain, frustration and uncertainty, all while being told it's just part of being a woman. 7 to 9 years of pain, often dismissed by healthcare providers as normal or psychosomatic. 7 to 9 years of suffering in silence. 7 to 9 years spent waiting for someone to take your symptoms seriously. That just isn't a delay, it's a denial of care and dignity. And I'd like to ask every man in this place, in this country, to picture what it would be like going to your doctor, describing severe and ongoing pain, and being told time and time again that it's just stress, or that it's just in your head, or that it's just a normal part of being a man. What if for nearly a decade your pain was dismissed, chalked up to overthinking or lacking of resilience? That's the experience of countless women in the health system. It's a systemic failure, it's not good enough, and it's long past time we addressed it. And that's why this government is taking action. We are committed to delivering a healthcare system that works for everyone, not just some. We're prioritising issues like reproductive health, mental health and chronic conditions affecting women. Backed by over $350 million in dedicated funding, we are advancing targeted solutions for women's health needs. Our commitment goes beyond the clinics I mentioned earlier. We're funding specialised training for healthcare providers, reducing diagnostic delays that have held women back for far too long. By investing in this training, we're creating a health system equipped to address the complex realities of women's health. We're also expanding mental health services for women with a focus on those affected by trauma and postpartum issues. By creating more trauma-informed support, we want to build a mental health response that genuinely supports women and recognises their unique experiences. We're adding vital services to the Medicare benefit schedule that directly benefit women. This will mean more appointments, more subsidised treatments and easier access to essential health care. And when it comes to preventative health care, we're not taking shortcuts, Deputy Speaker. By expanding cancer screening programs for breast and cervical cancer and investing in more awareness activities, We're helping more women catch these diseases early, ensuring better outcomes and relieving the emotional and financial burden of late diagnosis. To every woman who has been told to wait or told to bear it or to be strong, I want you to know that this government hears you, and under the guidance of the Health and Aged Care Minister and his very hard-working and committed Assistant Minister, I have absolute confidence that they will build a health system that respects women's experiences and affirms their dignity.